I can hardly believe I'm here. It's a dream come true.
Sadly, actor Christopher Reeve died before his dream of overcoming spinal injury was realised. We're just a couple of years past his death, and it seems one of the most promising answers to spinal injury may have existed within his own body. Here in Lisbon's Hospital de Egas Moniz, an amazing operation is underway.
This is olfactory mucosa. You can see that is near the roof of the nasal cavity.
Deep inside this patient's nose is what could prove to be one of the greatest breakthroughs in spinal research. Nose tissue to be transplanted directly into damaged spinal cord.
There you go. Come on. A whole foot length ahead. Okay, come on.
And here's the result.
I think the steps are getting better, but you can watch and you tell me.
5 years ago, Erica Nader had a car accident on the way to her parents' 25th wedding anniversary.
Erica, I'm going to be watching you walk.
Okay, tell me if it looks any better than before.
Okay.
Erica had almost total quadriplegia and was told she'd be in a wheelchair for life. 3 years ago, stem cells from her nose were transplanted into her spine, and she began intensive physical therapy.
You're almost at the end, so you're doing awesome. Come on.
For Dr. Stephen Hinderer, in charge of Erica's rehabilitation program, her movement speaks for itself. What sort of progress has Erica made over the last 3 years?
Erica has made incredible progress. She had partial use of her arms, none of her hands, and no trunk function or lower body function.
Like most patients with spinal damage, walking would be a dream. But most, in fact, have goals far less lofty.
There have been questionnaires and studies looking at if people had to prioritize, if you could get one thing back, and that was it. The number one choice typically is bladder function, followed by bowel function, followed by sexual function, and then perhaps walking. But the reality is if you talk to people in this program who seek this kind of procedure, they will tell you anything that comes back is well worth it because they were told not to expect anything.
Remarkably, all of those bodily functions appear possible for Erica. At least 7 patients have had the surgery in Lisbon, and she's the first American to undergo the 5-hour operation, pioneered by neuropathologist and stem cell specialist Dr. Carlos Lima.
This is the olfactory mucosa graft that we collect from the nose of the patient.
What's even more remarkable is that doctors aren't even sure why Erica is getting better. The cells transplanted are those that give us our sense of smell. And transplanting the tissue into the spinal cord is surprisingly straightforward.
It is a solid tissue, so you don't have to worry. You just have to put it there and close it in a way that it doesn't come out again. And that's it. Then all the things will go down inside. Will have to do with what nature thinks should be done, and also with the healing process of your own body.
The tissue goes directly into the break in the spinal cord. The inner lining of the nose, or the olfactory mucosa, is rich with a variety of cells that may help spinal cords repair. For starters, the tissue there rapidly regenerates, and it's full of lots of adult stem cells which have the potential to become nerve cells. And then there are the olfactory end-sheathing cells, or OECs, which encourage communication between nerve cells. And finally, you have growth factors. Now, as the name implies, they encourage the growth of cells. So all in all, you have a tissue with amazing potential. Stem cells tend to be controversial because early research concentrated on fetal stem cells. Back in the US, in Detroit, Dr. Jean Peduzzi Nelson has been closely following Dr. Lima's work. And she believes nasal stem cells may provide a breakthrough in medical treatment.
This may be a much safer alternative than using embryonic, fetal, or clone stem cells, because when you use your own stem cells, you don't have to worry about rejection. You don't have to worry about disease transmission.
The olfactory nerve is the only nerve in our body that constantly regenerates its nerve cells. Animal experiments using nasal tissue have shown evidence of nerve regrowth across the snapped spinal cords. How excited are you about the potential of this work in terms of humans?
I'm very excited because it's not a goal in my life, but it's more of an obsession.
This surgery isn't for everyone. The best candidates are aged 18 to 35, when cell regrowth is at its best. Spinal damage can't be too severe, and patients need the motivation to take on at least 2 years of intensive rehab.
You have to have patients who believe that the impossible is possible. And in that way, you have to choose very, very carefully.
Doctors and patients both say it's hard to say what plays the greater role in recovery, the surgery or the rehabilitation.
Better.
I don't know what it is. It's maybe a little bit of the surgery, a little bit of working out. I don't think that you can isolate them.
She keeps motivated. She keeps believing that she's going to have more and more and more. Maybe this is the most important.
Keep going. You got it. Stay. There you go. You fixed yourself. Awesome.
I think that's one part of this that's important for people to realize. It's not just simply go have an operation and get better. There's a tremendous amount of hard work and time and sometimes heartbreak.
If you think about a baby, they don't just get up and start running. They pull themselves up. They start kneeling. They start crawling. And then they stand, and then they start kind of walking, and it's funny, and they fall down. And so I have to go through those same things. It's just, I already did it, but I have to go through it again.
Getting a lot better.
Excellent.
I can tell I'm getting faster every day.
Excellent.
However the cells in the olfactory mucosa do their job, in the end it's the hard work of the medical team and the courage of these patients that's providing hope for everyone with spinal injury. It's still early days, but researchers in Portugal and in the US are cautiously optimistic that this innovative spinal cord treatment can make a difference. Now, obviously, recovery will require more than just surgery alone, and physical therapy remains vital. But if this nasal tissue transplant can live up to its potential, then one day it may become available worldwide to help people with spinal cord injury move towards recovery.